We are very proud that Embitron is a part of Certicon Group and contributes to the fulfillment of our main vision to create products and services based on the craft of our employees. Vacuum compression therapy has been in existence for over 200 years. That is how long people have known that the human body is controlled by physical and chemical processes. So they have been trying to help the body in this way. Docent Prucha, Embitron's founder, brought Extremiter back to light because we now know that only using chemical substances, pharmaceuticals, is not sufficient to treat vein problems, and physical therapy is needed to help the body. This means that Extremiter, which was modernized and brought back to the market by Docent Prucha, facilitates the body's basic physical processes and needs through vacuum compression therapy.
Extremiter is intended for vacuum compression therapy via the alternation of pressure and vacuum phases. The patient puts a limb into a cylinder to be hermetically sealed. The pressure in the cuff is controlled automatically and dynamically, which extends the possibility of this device's use for vascular and lymphatic problems. The most common diagnoses for which we use Extremiter include poor blood circulation in a limb, vein problems, including venous lymphatic edema, and chronic venous insufficiency with an already developed leg ulcer. Good results are also achieved for lymphatic edemas, as the device promotes lymphatic drainage. Other common diagnoses include lower limb ischemia, regardless of whether the patients have trophic tissue defects or claudication problems. The device is able to extend the claudication interval. We also have experience in the use of Extremiter in patients with vasoneurosis, such as Raynaud's phenomenon. Very good results are also achieved for post-surgery and post-injury conditions, including complications such as algodystrophy and arising pseudoarthrosis. Other very common diagnoses include peripheral diabetes complications, most commonly diabetic polyneuropathy, lower limb ischemia, and diabetic foot syndrome. Extremiter is also used for neurological diagnoses, for example, root syndromes, neuropathic pain, and neuropathies of various etiology.
Various machines for vacuum compression therapy were developed as early as 150 years ago in France and England, and then after the war in America and Switzerland. Our blood vessels work based on the principle of pressure and vacuums. The heart generates pressure to distribute blood to the most remote body parts. At the same time, the heart works as a pump to generate a vacuum, which means that it sucks the blood so that it gets back to the lungs to be oxygenated and then passes through other organs to be purified and so on. However, a problem occurs if there's an obstacle in the vascular system, whether because the vein is narrowed due to a disease or because something else is preventing the vein from letting a sufficient quantity of blood reach some body part. The device is controlled through a simple menu where we select from a group of diagnoses to get the particular diagnosis. For each diagnosis, a therapy is set as recommended by the manufacturer. However, the therapy allows an individual approach and may be changed for each patient. This means that we can select the therapy duration as well as the maximum and minimum pressure. We can also increase these parameters during the therapy. A setting that a patient wouldn't tolerate during the first therapy, which would be too much for him or her, can be increased in the second, and subsequent therapies to increase the therapeutic effect. If a vein is narrowed, blood transport is problematic and other harmful synergies occur. In such cases, it is very appropriate to use Extremiter, which was relaunched by Docent Prucha as Embitron's founder more than 20 years ago. Many physicians are beginning to realize the weaknesses of our modern medical system, which uses especially chemical processes, or rather chemical substances, provided by the pharmaceutical industry. This means various drugs and new chemical processes and effects that can work miracles in the body, but are powerless at the moment when we were unable to get the, in colloquial terms, chemical miracle to a location that is damaged by disease. In such cases, it is very appropriate to combine the treatment with vacuum compression therapy, putting the limbs or any other body part affected by a vascular disease alternately under pressure and under a vacuum. This means that we are not doing anything new, we are just trying to help the blood vessels work correctly. So we apply pressure to squeeze them and send blood back to the heart through all the filtration and other parts and organs of the human body. And we also use a vacuum to stretch or widen them to help blood to flow to the parts damaged by disease. Our Savoy West End Spa Clinic in Karlovy Vary is specialised in the treatment of patients with metabolic diseases, which means patients with diabetes, obesity and lipid metabolism disorders. We have had very good results in the treatment of these diseases, particularly because we use all the methods of comprehensive spa treatment as well as physical therapy and rehabilitation. We use various methods for the treatment of complications from diabetes, in particular type 2 diabetes. Such methods include rehabilitation and physiotherapy, and we combine these methods with comprehensive spa treatment. Based on my long experience, I can say that very good results have been achieved by using Extremiter for vacuum compression therapy, alternating pressure and a vacuum to treat various diseases, such as blood circulation disorders and diseases of the nervous system, especially the peripheral nervous system. We know that diabetic patients often have complications involving their lower limbs. They suffer from pains in their lower limbs and subsequent claudication. They also experience sensory disturbances, and Extremiter and its vacuum compression therapy improves both blood circulation and tissue nutrition. We have many patients who return to us repeatedly to undergo this therapy. In most cases, we perform this procedure on patients on a daily basis, applying it approximately 10 or 20 times if needed. The patient sees considerable improvement as early as after the first treatment, with improved feeling and mitigation of lower limb pain.
dolních končetinách. Krásně je vidět na obrázku.
The effect of the vacuum compression therapy is clearly seen in these pictures showing a lower limb before and after the therapy. You can clearly see that the vessels were constricted or not sufficiently clear before the procedure, while after the procedure the vessels are beautifully dilated. I'd say that they are completely new. A quite unsightly and problematic disease, such as a leg ulcer, is in fact a vascular disease. It's not a skin disease or disorder, as many people think, but rather a vascular disease that can also be successfully treated by means of vacuum compression therapy. At our venous surgery centre in Kojetín, we treat vascular diseases in the lower and upper limbs. We treat in particular venous and arterial diseases, and partly also lymphatic disease. To treat peripheral blood circulation disorders, slowed metabolism and impaired limb nutrition, medicine makes use of pharmacotherapy, surgery and therapeutic rehabilitation. Interesting results have recently been achieved by the application of controlled vacuums, also known as vacuum compression therapy. Vacuum compression therapy is a suitable hemodynamic non-medical therapy that is used in the comprehensive treatment of lower limb ischemia, in particular during Fontaine stages 2B and 3, when it is used as passive vascular exercise. In stages 1 and 2, it is a significant addition to active vascular exercise. I'm aware that the clinical assessment, and especially the patient's subjective assessment of the therapeutic effect, are not quite exact. But I believe that if a patient claims improvement in his or her subjective feelings and the claudication interval is demonstrably extended, and this extension lasts even 3 months after the completion of the therapy, the effects of vacuum compression therapy can be regarded as positive. The method places no demand on patients, is easily tolerated, and demonstrably improves blood circulation in the peripheral parts of the lower limbs. The point is that in a correctly functioning vessel, the smallest parts that are formed in the internal vessel wall and pass through the wall actually build a new vessel under the pressure and vacuum from the heart's activity. This is the process of renovation and regeneration in the human body, where blood vessels are continuously renovated and work properly due to the proper and healthy functioning of our vascular system. When a problem occurs, the body is so ingeniously arranged that a sort of bypass or natural interconnection is ready on a large blood vessel. Using vacuum compression therapy, we can activate the self-regeneration system or process using pressure and a vacuum to simulate the proper functioning of the vessel, which will begin to work by itself, and the self-regeneration system will help the vessel to recover.
We are able to treat edemas of venous origins, including lymphatic edemas, where we support lymphatic drainage. Trophotropic effects include improved blood circulation in the limb and improved nutrition metabolism and oxygen supply. These effects last a long time because Extremiter stimulates the development of new capillaries. The most common diagnosis for which we use this device is edema, regardless of whether of lymphatic or venous origin, including already existing leg ulcers. We also use Extremiter for blood circulation disorders, for example, lower limb ischemia, no matter whether the patient has claudication problems or already suffers from trophic defects. It is also used for vasoneurosis, for example, Raynaud's phenomenon, and post-surgery and post-injury conditions. We also use it for algodystrophic syndrome and arising pseudoarthrosis. It is also efficient for neurological diagnoses, for example, root syndromes. and also in patients with polyneuropathy of various etiology, and patients with neuropathic pain. Very good effects are achieved in patients with diabetic foot syndrome and peripheral diabetes complications, whether polyneuropathy or lower limb ischemia.
If a blood vessel is damaged, we can't get the pressure in. This means that we need to figure out how to alternate application of pressure and a vacuum to the vascular system, or the place where the vessels are damaged or diseased. Extremiter has gradually evolved over time. I've been using this device with my patients for almost 25 years. In the past year, we've bought a new device called Better Future. Better Future means that the device is supplemented by carbon dioxide. This improves the device's effects as well as blood circulation and helps with neuropathic problems. So this strengthens the effect from vacuum compression therapy. We also use vacuum compression therapy for patients who are treated in our facility for leg ulcers. As a matter of course, the ulcer must be clean and the area around the ulcer must not be inflamed. These patients undergo a therapeutic series of 20 procedures, meaning 5 times per week for 4 weeks. Each procedure has 10 cycles of alternating pressure and vacuums of 5 kPa for 30 seconds. Regarding the results and evaluation of the therapy, we can say that all patients have tolerated the therapy without any reservations. Edemas and leakage around ulcers and perimalleolar edemas disappeared during the therapy. Skin nutrition has improved in all cases, and ulcers healed over in 2 patients. All patients have reported the mitigation or elimination of pain. Extremiter is able to considerably influence the course of diseases such as diabetic foot, leg ulcers, and other ischemic problems. However, what is essential is our approach to ourselves and our health. There are alarming and very interesting statistics which show that in the Czech Republic, every year there are over 60,000 new cases of diabetes diagnosed and tens of thousands of people dying from diabetes-related problems. We can even say that if we do not realize all of the risks associated with diabetes, in a short time we'll be unable to bear the costs of combating diabetes and its synergies. We won't be able to finance our own laxity and irresponsibility. Extremiter can save a leg or hand and considerably improve a sick person's life, but cannot prevent the disease itself. Only we ourselves can do this. We are proud that Embitron manufactures and launches products based on purely Czech research and manufacturing, and provides a range of products that do not use chemicals and are based on modern physical and cybernetic methods. It's a promising direction, and we would like to continue in this direction in the future, because people's health and satisfaction is what matters most to us.